This video is sponsored by Allergy Eats, your online guide to allergy-friendly restaurants. Visit us at allergyeats.com.
Hello, my name is Donna Milani Luther. I'm head at Inley School here, which is a co-ed preschool through 8th grade. We start with toddlers at 15 months and go right through the 8th grade. And we're delighted to be here this evening with all of you for this very, very important topic. I'd like to thank our parents group. It's the Food Allergy Support Network group that is helping us out supporting this evening, and most particularly our board chair, Paul Antico, who has helped sponsor the evening. So I'm going to introduce Paul, who will introduce our guest.
Thank you, Donna. I often don't have these close enough to my mouth, so just wave if you can't hear me. So welcome, we're glad to have everybody out here. My name is Paul Antico. I'm the father of 5 children, 3 of whom have food allergies. You can pity me for the former, not the latter. 3 of whom have food allergies. I started a company called Allergy Eats, an online guide for allergy-friendly restaurants, and I'm very proud to be the president of the board here at Inley. I think it's very appropriate that we have such a great speaker here at Inley, because our school, in my opinion, has been not just a pioneer in dealing with food allergies, but really progressive, when a lot of other schools right now are struggling, trying to figure out how to accommodate food allergic students and keep happy the other 94% of the population. We've really been on the cusp thanks to efforts led by our head, Donna Luther. We have been a nut-free school for over 10 years. We have, not only, of course, do we recognize nuts, but we're great at accommodating individuals with every allergy under the sun. We understand the severity of it. The community understands the severity of it, and really understands that these children need to be accommodated and that they're just like every other child. You know, they come on the play dates, they do the birthday party. So the fact that we've been an allergy-friendly school for 10 years has really helped us create an allergy-friendly community, and that's wonderful. We are unfortunately, it's sad to say in this day and age that it's a luxury to have a full-time nurse, but we do, who's on the side, and she's trained all the staff in food allergies and in the use of EpiPens, which is fantastic. We have EpiPens in all the classrooms, again, a luxury that most schools would never even consider. And as I learned the other day, Ruth, our nurse, also has a special cell phone specifically for the, God forbid, an anaphylactic reaction. So we're really prepared. We're a great school in terms of handling food allergies. And now, thanks to the efforts of Johanna Power and some of the other people here, we have a food allergy support group. And I'm very proud of that. I'm very proud to be a part of a school that's been so progressive in this way. Part of that, of course, is celebrating Food Allergy Awareness Week, and that wouldn't be complete without having a wonderful speaker. I don't even know how to describe. I have to read a lot of Dr. Pistiner's bio because he's accomplished so much. Clinical instructor at Children's Hospital in Boston, voluntary consultant for the Massachusetts Department of Public Health, School Health Services, and the American Academy of Pediatrics Council for School Health. And I think of him more as the awards, and I saw Dr. Pistiner win another award last night, but awards from the Food Allergy and Anaphylaxis Network in 2009, 2010, I guess we can say in 2011. Scrap this. Dr. Pistiner is a great guy, first and foremost. He's an amazing advocate. He was instrumental in helping pass the Massachusetts food allergy law that benefits all of us every time we consider going out to eat. He's now an accomplished author, and we have his book in the back, Every Day Cool with Food Allergies, and just a wonderful speaker. He's associated with the Asthma and Allergy Foundation of America, the New England chapter, the Food Allergy and Anaphylaxis Network, if I can speak well, and he's on the board of Kids with Food Allergies. Those 3 groups are the 3 major food allergy groups in America. So he's accomplished as they come, and I'm going to turn it over very gratefully to Dr. Pistiner.
So today we're going to talk about educating and empowering our kids to manage their food allergies well. First, I'm going to make a couple points. Point number 1, the unknown can be scary. So kids come up with their own answers. What happens at the dark? What's underneath their bed? These are good examples. Point number 2, children believe grown-ups. That's all I have to say. Hopefully there's no kids here, so we won't let the cat out of the bag. So with food allergies comes uncertainty. And without the facts, uncertainty can lead to fear. We really need to be aware of the messages that we're giving our children. So the goal of my talk is to help you address the uncertainty and the fear of food allergy and replace it with facts and empowerment. To provide you with practical advice to help maintain quality of life and safety of the child with food allergies. So, as we all know, there is very real psychological impact on kids. Some kids are afraid of getting sick. Some kids are afraid of dying. Some kids are afraid, actually the majority, of ridicule, of being responsible for unpopular classroom policies, carrying EpiPen, being different from their peers, not being able to eat what the other children do. Sometimes there's actual social isolation where they have to sit apart from their friends. Some studies show that they have increased association of behavioral issues. One study showed that they had a lower quality of life than children with type 1 diabetes, those who necessitate insulin. Another study shows decreased school attendance, and another up to 10% of people were needing or chose to be homeschooled. There was a small study looking at the discrepancy between what kids felt and what their parents thought they felt. In it, the parents were very concerned about the children's health, while the kids felt that the worst part of having food allergies were the social issues. And of these children, 3/4 said that they thought that they would be able to give themselves an EpiPen. And these were adolescents. And so there's very real psychological impact on the families of kids with food allergy. One study showed 50% had a significant social stress. 50% with an effect on their social activities, 40% with significant stress. Now, interestingly, they found that 60% had an effect on meal preparation. I would argue that 100% should. So what can we do to address these psychological issues? If we directly confront them, we can bring some of the feelings to the surface and allow families to appropriately deal with them. We can teach our kids to manage their food allergies in age-appropriate fashion. So this is the elephant in the room, mortality. So fatal anaphylaxis does happen, but it's rare. And from the perspective of a father with a child with food allergies, when I look at the data and I look at what some of these cases show us, it actually makes me feel a little bit more comfortable with things, and especially from the perspective of a doctor. There do seem to be things that we can do that will significantly make a difference. So they looked at a collection of cases of mortality. And what they found was that the sheer majority were adolescents and young adults. 70% of the mortalities were between age 12 and 21. The majority occurred away from home. The majority were in unintentional ingestion of a food that people already knew that they were allergic to. Peanuts and tree nuts were very common. Asthma was seen in almost every case. 80% of the reactions were preceded by only mild ones. And almost 90% there was a delay in the administration of epinephrine. So now when you take all these facts together and you look at it, it looks like this may be behavioral. It may be that we have risk-taking young adults who don't want to be different from their friends, potentially eating things that they shouldn't be, and not having their epinephrine, the appropriate treatment for anaphylaxis, available. It looks like something that we can intervene on, we could make a difference. So why these young adults? What's going on here? There's a transition to self-management. They have complicated daily schedules. multiple new responsibilities, and tons of social pressures. To address this, a study was done called Risk-Taking and Coping Strategies of Adolescents and Young Adults with Food Allergy. What they found in this survey was 54% of kids with food allergy knowingly ingested a potentially unsafe food. 42% were willing to eat foods that may contain labels, the cautionary labels on them. 60% were willing to tell their friends. And 61% said that they always carry their epinephrine. So we have a very difficult balance here, one of anxiousness and one of risk-taking. And allergic reactions can be dealt with reasonably while maintaining quality of life. So educating and empowering is absolutely critical. So how do we do it? We want to coach our kids. We want to get to know our opponent and get to know food allergy. So we want to help them study the plays and get to know where they're vulnerable, to help them go in with a plan, which is our avoidance strategies, and to have good defense, allergy action plan, and self-injectable epinephrine. So let's teach them the basics. First off, food allergy is an abnormal immune response to food protein. The most common food allergens are milk, egg, peanut, tree nut, wheat, soy, fish, and shellfish. Symptoms could be anywhere from mild eczema to cramping, vomiting, diarrhea, coughing, wheezing, shortness of breath, faintness, dizziness, really anything. The majority of food allergic reactions occur minutes to several hours after ingestion of the food. Anaphylaxis, and you'll hear me talk about this, is severe life-threatening allergic reaction. It could start with mild symptoms, and between 10 and 20% of the cases don't have any skin findings. And so that's something to keep in mind.